Hi, I'm Kerri Hollywood from CFB Kingston, and today I'm at Helix Hearing Care Center on Princess Street right here in Kingston, and I'm going to get my hearing tested for the very first time. So this is going to be really interesting. Let's go. Come with me. Hi, Nikki. How are you?
I'm good. How are you?
Good. Can you tell everyone exactly what you do here?
Sure. I'm a hearing instrument specialist, so everything from assessing and diagnosing to fitting with hearing aids and all of the follow-up appointments after that.
I have never had my hearing tested before, so this is going to be an interesting day.
And it's overdue because you should be having your hearing tested, right away before having any problems, so that you have a nice baseline and just for overall health.
So is that something that most people don't know? They assume that you have to be old to get a hearing test?
A lot of people come when it's so bad that they can't function anymore. By then, we don't have a baseline, so we can't see, has there been a major change recently? Or, is there a difficulty that's linked to an event? So it's always better to have a test first.
Awesome. Well, I'm excited to get started. So what do we do first?
All right, so first I would take your case history. So I would ask you some questions. Do you have any family history of hearing loss?
No.
Okay, and get a gauge of whether you're currently having difficulties or whether this is a baseline test. Then we go into some specific medical history. So a lot of things that people don't know is that some medical events in your life can affect your hearing. Things like radiation treatments, things like different medications that you can use. So it's important to talk about, the entire healthcare aspect and history so that we can link any risks in together.
Lifestyle and probably work, right? Your work history has a lot, and our military members would know this. A lot of them have worked with artillery and other things that may impact their hearing.
Hearing issues that come from occupational noise exposure can degenerate over time. So, and getting those benefits, whether it's Veterans Affairs benefits or WSIB benefits, they don't expire. So it's not like you have to have taken that test and applied for that within 5 or 10 years. I've helped people in their late 90s apply for something back when they retired at 45. Like, these are things that are important to talk about what your hearing could be from, what your hearing loss could be from, and then let the clinician kind of guide you in what available benefits there could be.
Awesome. Well, let's get started.
All right, so I'm just going to take a look into both your ears here. So this is putting air out. So what happens is this creates a seal around your ear canal, and this fills your ear canal with enough air to see, how your eardrum is reacting to it.
Nice.
And then how it reacts to it can kind of dictate what's behind it, whether there's pressure or fluid or anything like that.
Okay.
All right, so now that I have an idea about the health of your middle ear, we're gonna go on into the booth and see what your hearing's like.
Okay, let's go.
All right, so we've got you all set up here. I'm gonna give you this button,
Okay.
but I'll give you instructions as we go when I'm on the other side, okay?
All right. Sounds good.
So we're gonna go ahead and start with a beep test.
Okay.
Whenever you hear a beep, no matter what volume it is, whether it's comfortable volume or very, very faint, I just want you to push that button that I gave you, okay?
So when I hear any beep at all, I push the button.
That's right.
Got it.
Perfect. Can you hear me in your left ear?
Yes.
Awesome. And if I gave you a remote control, is this where you'd have me volume-wise, or would you turn me up or down?
I'd probably turn your voice down a little bit. I hear you in my left ear.
And so more comfortable at this volume right here?
A little lower,
Or
I guess.
a little bit lower from here? So right now I'm speaking again just in your left ear. Is this the volume that you'd keep me at? All right, I'm gonna have you repeat after me, okay? Mousetrap.
Mousetrap.
Daybreak.
Daybreak.
Doormat.
Doormat.
Hardware. Cowboy.
I don't know what you're saying. I can't hear you.
Duck pond. Warehouse. Doormat.
Doormat.
This one's actually really cool. You're gonna hear beeps without anything in your ear.
Okay. Okay, so it attaches just below my ear, kind of.
It's right on top of your mastoid. So I'm essentially vibrating the bones in your ear and in your head to make the sound frequencies go right to your nerves or your inner ear.
Neat. This should be fun. Okay, I've got my button.
All right. So of course this would be a fun case. We're going to do something called masking. So right now you're hearing the sounds coming through on that part of your ear. I'm going to put some noise on the other side of your ear and see if I can kind of block out one ear and let you hear only with the other, okay?
Okay.
So for this test, you're only going to push the button when you hear a beep. Only a beep, okay? Ignore everything else.
That's funny. So you have an ocean in one ear and beeps in the other. Nice.
Okay.
Very cool, I must say. Okay, so tell me, Nikki, all about my hearing.
You do have normal hearing in both of your ears, which is wonderful.
That's good.
On this test, I was able to test many parts of your ear to get a full picture, okay? So that little probe that I put in your ear at first, that was testing how the middle part of your ear is working. So how your eardrum is working, how the pressure and the fluid in there is going. You have no issues with your middle ear that I can see. It looks great, okay? Then I test the volume. So when we look at this graph, we're looking at a few different things. We see here the volume part is low to high volume. And then this we kind of think of as a piano. So low pitches to high pitches, okay? When we look here, we see X's, which are your left ear, circles, which are your right ear, and that's what we're gonna focus on right now. So what we wanna see is that all of those symbols are above the line of normal hearing. And they are nicely above that line. If I bypass your outer and middle ear, how are we functioning in the inner ear? That was the little piece that I put on the back.
Okay.
And what we should see is that all of those symbols, so these symbols right here, are nice and tight together with how your ear is working as a whole. And they are. So that indicates that there's nothing wrong acoustically with the middle part of your ear or the outer part of your ear. And then I got to test your clarity. And this is often my favorite test because this tells a lot. You actually got 100% on that recording.
Probably the only time in my life I've gotten 100% on something.
And you know, not everybody does. Sometimes there's damage done to the inner part of your ear or, you know, where it connects to your brain. And sometimes that happens that you can have the perfect volume, but it's not necessarily as clear as it used to be. So we can see where sometimes the volume is fine, but the clarity is lacking, right? Or if the volume even is down here with perfect clarity, that is a wonderful, beautiful hearing aid candidate, because if you make the volume where it needs to be, that person is going to hear beautifully. The last thing I tested was the lowest that you could hear speech. The lowest not only that you could hear it, but that you could make it out. It's wonderfully normal, it's average. 15 decibels in the right and 20 in the left. Average speech is about 65 decibels. So the entirety of this test, I would call this hearing within normal limits bilaterally, so on both sides. And my recommendation would be to have a hearing test every 5 years, sooner if any concerns arise.
Okay. These tests are absolutely free for people?
Absolutely free. Children are a little bit more complex, so children are a fee of $75. Anyone over the age of 18, whether you have a referral from the doctor or whether you saw us from here or in the newspaper, it's totally free.
So there's no reason why someone shouldn't come and get a basic baseline test for themselves.
Mm-hmm.
So I hope everyone else comes in to see Nikki. So book your appointment today.
Looking forward to seeing you.
PSP Kingston, the health and wellness provider for the military community.